In this video, I'm going to discuss the two pathways that leads to the activation of the apoptosis. So apoptosis is referred to the cell death that is occurring in a programmed manner. And so it's the body that wants to kill those cells for whatever reason it is, whether it's for the tissue remodeling, for homeostasis, or for instance, let's say that there was some bacterial infections and there are too many immune cells, so want to kill those immune cells. So that's the way that body can adjust the number of cells by the apoptosis. And so therefore it's a non-inflammatory process versus necrosis, which is a pathologic death that is associated with cell swelling and inflammation. Now, regarding the two pathways that leads to the apoptosis, with the intrinsic pathway, when there is DNA damage or some sort of cellular injury, or for instance lack of the growth hormones, it will cause inactivation of the anti-apoptotic BCL2 proteins or the activation of the apoptotic proteins BAX or P53, as a consequence of which they would cause the leakage of the cytochrome C out of the mitochondria, and cytochrome C will lead to the activation of caspase, which will cause apoptosis. On the other hand, with the extrinsic pathway, it can happen either by binding of the Fas ligands or the tumor necrosis factor to its receptor, which will again leads to the activation of the caspase, or via the CD8 killer T-cells, which will open the cells by perforins and then release the granzymes inside the cell, which will again lead to the activation of caspase. And then caspase will lead to the breakdown of DNA and cytoskeleton by activation of the endonuclease as well as pro-apoptotic enzymes. And that concludes the discussion of the apoptotic pathways.